Hi, Dr. J. George, bariatric surgeon. So, after thinking about how you want to lose weight and get healthier, and if you've decided to move forward with a bariatric procedure, a surgery, it's really important to keep in mind the big picture about what you're trying to achieve and your goals. Uh, Most people that I talk to that are interested in surgery to lose weight obviously not only want to lose their weight, but they want to keep it off. And the only way that I know how someone can do that is through changing behaviors, changing their habits. It's a concept called behavioral modification. So the surgery that we would end up performing or doing is a tool. It's a powerful tool, but it's a tool. And patients are going to get a honeymoon period of 1 or 2 years, depending on what procedure is performed, where, yeah, they're going to have a great deal of weight loss and they're going to be losing weight rapidly. But if you really want to do it right and you want to keep that weight off long term, it's really important that you follow up with a program on a regular, consistent basis after the procedure, because things are not going to just miraculously change the day after your operation. Sure, you're going to feel different, and your appetite's not going to be there, and you're going to not be able to eat as much, but your body has an interesting way of adapting. And so the way that you choose how to live your life afterwards boils down to learning new habits. And so what consistent follow-up is going to do is it's going to help teach you those new habits, continuing with what you've learned in the program beforehand. It's going to help hold you accountable, and it's going to allow you consistently over and over and over again to verify and to solidify these things that we're teaching you. So 90% of this after your surgery is eating. And so the way that you are grocery shopping or cooking for your family, or your portion size, your snacking, that all has to be basically boiled down to a science. And you have to put a lot of energy and a lot of effort into it over and over and over again. And it's going to get sometimes frustrating, and sometimes you're going to slip, and sometimes you're going to, say, well, why am I doing this? But the hard work will pay off. If you're willing to put in that kind of energy and that kind of focus, and you're willing to use us or a weight loss program as sort of like your lifelong personal trainer, eventually over time, it's going to get easier. But we're not going to take a lifetime of behavior and just change it overnight. And so, we expect our patients, at least for the first year, sometimes 2 years, to come in on a monthly basis after the operation. Every 4 weeks, you're hitting the door, you're showing us how you're eating, showing us your food log, making sure that we're putting good practice or good habits into practice. And once you reach your weight loss goal over time, and once you can demonstrate to yourself and demonstrate to us that you're really getting the hang of things, then we can start taking the training wheels off and start backing off on the frequency of your visits. And for most people, that takes 1 to 2 years after their surgery. So, for people that aren't doing that, that aren't up to cast for it, and are just coming in a couple of times, and then, we don't see them for months or a year or two, you're not going to get good results that way. You're just not. And unfortunately, people that don't have that consistent follow-up initially, they're not going to either lose the weight they want, or they're not going to be able to keep their weight off. So I want you to keep that in mind as you're going through this process, and as you're trying to figure out how to achieve your goals. Realize that it takes a lot of energy and a lot of dedication on your part after a procedure to kind of get the hang of things so that you can maintain your weight loss long term.